There are two varieties of axillary pathway in an ECG. One, in a normal sinus rhythm, the pathway can be obvious, which is called manifest bypass tract. What happens here is, as you can see in the slide, the activation of the ventricle during normal sinus rhythm occurs both over the AV node as well as the accessory pathway. So as you can see, this is a fusion beat where part of the ventricle is pre-excited from the atrium to the ventricle across the pathway. When it conducts through the pathway, the conduction is through the ventricular muscle fibers, so the conduction is slow, which gives rise to slurring of the initial part of the QRS, which is also known as delta wave. And since it bypasses the AV node, PR interval will be short. So in a manifest bypass tract, the patient's ECG will show a short PR interval and a delta wave, which is known as a manifest bypass tract. This is a 12 lead ECG showing a pre-excitation in the form of short PR interval and initial slurring in the QRS complex, which is also called as delta wave. This is another variety where the pathway conducts only retrogradely. There is no conduction from above downwards. That is, there is no antegrade conduction, and pathway can conduct only retrogradely from ventricles towards the atrium when there is no evidence